Good day, Sir Ramo. I am Christopher John Doria, a BSc 1C student from Buckentrack College. And today, I am going to perform the procedure of physical assessment from 192 to 233, which is the abdominal and the musculoskeletal system. Here are the equipments that I'm going to use. First is the paper and pen for documenting the findings that I'm going to find. Now, the skin marking for the skin, the goniometer, and lastly, my stethoscope. And now I'm going to start. Good day, sir.
Good day.
I am Christopher Jandoria, your student nurse for today. So can I sit here po? Okay. So what I'm going to do, sir, is to ask you muna the language that we're going to use throughout our conversation. So ano po ang language gamitin?
Vernacular.
Vernacular. Okay, vernacular. And now, sir, I am going to ask you the following questions. So first po, ano po yung name niyo? Zachary Madridano. Your date of birth?
December 29, 2005.
December 29, 2005. So, ano po yung gusto niyong itawag ko sa'yo?
Sir Zach.
Zach, sir? Kailan po? Sir Zach. Okay, Sir Zach. Now, Sir Zach, what are we going to do, Sir Zach, is to get your physical assessment regarding sa mong abdomen and your musculoskeletal system. So, before we start, first I'm going to get my hand wash, okay? Okay, sir. Wait for a moment po. Now, I am done washing my hands. Now, let's proceed to our actual physical assessment. So, first, sir, I am going to ask you sa imong history taking regarding sa imo ang abdomen. So, sir, naba kay mga abdominal pain?
No.
No? No, wala kayo na-feel?
Wala.
So, before, naba kayo na-feel ng abdominal pain?
Wala. Before?
So, kad yun, sir, throughout your
Naa.
life?
Naa.
So, usually, asa dapit po siya, dapit maano? Location sa imong kuan? Abdominal, sa imong sakit na. Sa chest man na, sir, sa imong abdominal po.
Balik.
Ayun. Sa imong abdominal po, sir. Dito po, right here po. Dito, sakit sa tiyan. Wala ka nagkalibanga, sir. Mga na, sir. Before, nagkalibanga. Asa po dapit? Dire nga part ba? Dire. Okay. So, mostly po, pag magsakit imong tiyan, unsa may mga like, following nga mga butang. Like, kaano ba ka? Nagkasuka ba ka? Nagasuka ka? Or nahilo ba ka sa gara? Or nagkakalibanga lang? Kalibanga lang usually. So, ang hinungdan ang anong gaya na is because of your change of appetite, naglahi lang kapag kaon diretso, or the food intolerances. Like for example, if ang tao is having lactose intolerant, which doesn't have the ability to digest milk. And there are people also who have mga ganun and mag-ask lang po anong food na take nyo regarding 24 hours. Gulay? Unsa pa?
Chocolate.
Gulay, chocolate. Rice, sir. Di mo ga rice? Rice, sir. So, mga to, gulay. Okay. Naka-feel ba kag mga heartburn? Kanang kuan? Mga sir? Galisod kag swallow. Wala pod? Mga sir? Mga gavomit pa kag blood. Sukad-sukad ba? Wala pa. So, previous po, nagka-problema po ba kag mga stomach ulcer? Kanang ulcer? Kabalo na ka ng ulcer, sir? Wala ka nang kaingana? Surgery, sir? Sa mong abdominal? Wala pod? Okay, history of jaundice, kanang change of coloration sa imong kuan, lawas. Na-yellow ba na siya? Hala? Okay, sir. That's nice. After doing our history taking for our abdominal, I'm going to proceed to the actual cutting of the abdominal data. So, sir, mag-ano po kayo, mag-go in na supine position. So, ang supine position po, sir, is maghiga lang po kayo. Higa po, right here po. Sige, sir. So, I need the patient to only the abdominal to be the one yung nakikita lang. So what I'm going to do is to ask her to get his upper dress. Okay, sir, maghubad po kayo for your upper dress. Okay, sir. sir? Now, I am going to get my blanket here kasi we only need to get the abdominal area exposed, so I'm going to cover the other part because it would avoid chilling and shivering that can tense abdominal muscles. And now in the abdomen, I'm going to place some pillows for his knees. Sir, taas po yung knees niya. Ito, the other one po. And that's it. And now, I am looking at the abdominal, inspecting it right now. So what I find is that the abdominal skin integrity. The skin integrity of the patient has an unblemished skin, and he also have, sir, baba lang po yung kamay niyo. Okay po, thank you. And he also have uniform in color of the skin. And now I'm inspecting the abdomen for contour and symmetry. And the abdomen contour is flat. It is rounded or convex on contour. And now I am looking for ano po, sir, breathe po kayo, sir. Breathe and hold. Like, breathe po kayo, then hold. Stop breathing then. Okay po, breathe in, deep breath, then hold. So, doing that could allow me to see if there's an enlargement, and I don't find any enlargement, which is good. So that means that there's no enlargement in the liver or spine. And now, I am going to stand at the foot so that I can see it properly of the contour of the abdominal. And I can see that it is semi-controlled, the abdominal. And if distension is present, I'm going to measure the abdominal distension. So I'm going to use this and the marker, the measurement. Now I'm going to measure the umbilicus level, finding the abdominal girth. So I'm going to do that and going to measure the abdominal girth, and that is that. But if the patient doesn't have any abdominal girth, then that's fine. But if there is, then I'm going to measure it. Now I'm going to proceed to observing the abdominal movements. I'm going to let the patient move by respiration, so I'm going to observe first. And there is symmetrical movement caused by respiration, which is good. And there is visible peristalsis. And now, I am observing for vascular pattern. And I don't find any visible vascular pattern. Now, what I'm going to do next is to auscultate. Now I'm getting my stethoscope and wearing it right now. So now, I'm going to auscultate the abdomen. So I'm going to make sure that my hands and the stethoscope is warm. And it's kind of warm right now and my hand is warm. So it's no problem. That is, I'm doing the rationale behind this is because I would not want the muscle to contract. And by hitting both my hands and the stethoscope, that prevents it. Now, I'm going to look for vowel sounds. And I hear that the vowel sounds is audible, which is normal because vowel sounds happen every 15 to 20 seconds, especially after the patients eat. So sir, kumain po ba kayo? Kailan po kayo last kumain?
Kanina,
Hapon. So around like 3 to 4 hours ago. Okay. So usually after eating, the abdominal is more louder because of the bowel sounds, because it's digesting the food, and that causes it to be more audible, or there's a lot of sounds here in the abdominal. And now I'm going to auscultate the four quadrants of the abdomen. So first, the left upper quadrant. Now the right upper quadrant. Now I am going for lower quadrant of the left. And now for the right lower quadrant. And I hear that there's a gurgling sound that I hear of the bowel, and it happened between 5 to 20 seconds. And now, I am going to look for vascular sounds. And now I'm going to use the auscultate the parts of the heart, like the abdomen, the aorta, the renal artery, the iliac artery, and the femoral artery. And I don't find any presence of arterial roots, and there's no peritoneal friction rubs. Now after that, I am going to proceed in percussing, and I'm going to first percuss the four quadrants of the abdomen in a systematic pattern. So I'm going to start at the lower right of the lower right quadrant. Okay lang po kayo, sir? Hindi po masakit? Why are you laughing, sir? Nakikiliti po kayo? Okay, so just tell me if masakit po yung pag-ano ko.
Ay, sige, sir.
Now I am in the left quadrant, specifically the upper. Now going lower. And I hear that there's tympany over the stomach and gas-filled bowels. There's dullness, and especially over the liver and spleen, or a full bladder. So sir, you have a full bladder. And now I am going to percuss liver to determine its size. So what I'm going to do is to place my hands over the region of liver. Liver. After doing our percussion, now let's proceed to the last one, which is palpation. For palpation, I'm going to palpate first the patient in a light manner. I'm going to place my hands in a circular motion and ask the patient, so tell me about me, sir. Ano po, sir? Kaliti po. Ay, sorry po. Now, I don't find any tenderness, and the abdomen is relaxed with smooth, consistent tension. Now, for the liver, I am going to ask the patient to breathe 3 times. So, sir, can you breathe 3 times po? Can you breathe 3 times po, sir? Breathe kayo 1, 2, 3. Tapos pagka 4, 1 is breathe kayo ng deep breath, then hold, then mag-stop po kayo ng breathe. Okay po, so 1, normal lang po, 2, 3, then last one, deep breath, then stop. Now I'm going to right upper quadrant. Now I'm going to put it in my hand, right upper quadrant. Yan, okay na po, sir. So what I did earlier is that by breathing, it pushes the down the liver to facilitate palpation. And I find that the liver, I detect I detect smooth, regular in contour, and firm and non-tender, which is good. Now I'm going to palpate the bladder. And I don't find any abnormalities such as urinary retention. Now I'm going to find my finding regarding the inspection, the percussion, inspection, auscultation, percussion, and palpation of the abdomen. Now, I am going to proceed to our musculoskeletal system. So sir, you can you can sit here and you can yes po. You can dress na po. Wait, I'm going to remove the blanket first. So sir, mag-ask po ako ng following question. So have you ever feel muscle pain?
No.
No muscle pain? Okay. So there's no any redness and swelling joints, mga nagpula po or swollen or naghubag ng mga joints? No?
No.
So before po, if mayroon kayong ganyan injury regarding your kuan, does it hinder you or nagbibigat po ito, hindi nagpapabigat po ito ng mga nyo activities, like daily activities sa daily livings, like getting up? No? Kaya wala pa ka naka-experience po? Okay. Sure po kasi sir. And do you do sports, sir? Ano po yung sports niyo?
Basketball.
Basketball. So have you ever been injured sa basketball? Sa ano po kayo na-injured?
Sa
sa paabanda. Okay. So after injury po, naapektuhan pa ba yung inyong daily living? Like naapektuhan how? Maglisod po kayo na sige na kag higda kay galisod kag kuan lihok. So dako kay epekto si mo to. So karon sir, okay na kaadto sir? Okay. Now, I am going to start in the muscles. So this is the arm, the thigh, and the calf. So I am inspecting both. Now sir, get ano po sir? Ganyan. Now, I am inspecting both muscles of the body for size, and both body is equal. And I am inspecting the muscles and tendons for contractures or shortening, and I don't find any contractures. Now, I am inspecting the muscle for tremors. And sir, before I do that, ano po sir, elevate po yung hand nyo, ganyan po. Hands elevate. Ganyan po. Elevate po. Ganyan lang po. And I don't find any tremors. Now, baba na po sir, okay na po. Now, I'm going to palpate muscles across to determine muscle tonicity. So sir, I'm going to palpate po. And that is good for muscle tonicity. Now, I am palpating the muscles while clients is active and passive for placidity, spasticity, and smoothness of movement. So, what I'm going to do is to test the muscle strength and compare. So, now I am going to first attempt to get the muscle strength of the sternocleidomastoid muscle. Sorry. So, dito po, yung ano nyo po, left tripod po. Okay. Now, sa right naman po. Okay, now that's like 4. And try sa imong, ano po sir, trapezius, try to shrug po sir, ganyan, shrug. So shrug sir. So that's 5. That's 5, I graded 5. And now I'm going to proceed to deltoid. So the previous muscles are symmetrical in strength. No sir, ganyan niyo po yung ano nyo kamay. Try to ano po. While I push it downward. Okay sir. Now for our deltoid, it is 3 out of 5. And now I'm going to proceed to triceps. No, biceps. So sir, right here po. Ganyan po. You try to put your hands up while I'm going to put it down. Now that's 4. That's 4. Both are symmetrical. And now I'm proceeding to triceps. So sir, yan po sir. So, sir, go. The other side. That's definitely 5. And now for our wrist and finger. So sir, I'm going to put your wrist po ganyan po. Dikit ang gagawin niyo po is you try to resist na hindi po magdikit yung fingers niyo, okay? Sige, dito. Ganyan po. No, straight lang po. Okay, other hand po. Straight lang po, hindi po ganyan. So that's 3 both. Now sir, we're going to test your grip strength. So i-grip po yung hands ko. So left hand po muna. Sige. Okay, the other side po. So that's 5 strength. Now I'm going to test his hip muscle. So sir, bumalik po kayo ng in your lying position sir. Higa po ulit. Okay po. Higa. And now sir, try to raise your right feet first. right feet po sir. You try. Your left feet po sir. Now the clients have the 4 and both symmetrical. So now abduction. So sir, what you're going to do sir is yung legs nyo po. They try to sir, like to this side. Ganyan po, that side. Ganyan po. So do it. Hindi po, straight lang po sir. Okay, the other side, the feet po. Sige po. Okay, that's 4 of 4. And now for hip adduction. So spread your legs po sir, spread po. Then try to bring it inward po sir, inward na naman. Opposite po kanina. So sige po. One side lang po sir, right lang po muna first. Sige. The other side po. Other side. So the left foot is 3 while the right foot is 4. Now sir, I'm going to check your hamstring strength. So what you're going to do sir is, so ganyan po yung knees niya. Taas po, gama. For an angle. Sige po, an angle. Galang po, sige. Then I'm gonna try to, i-try na ko siya i-straight yung feet niyo sir. Wali mo siya i-try to raise. Okay, so right feet 5, now left feet. Left feet is 5, still 5. Now for your quadriceps, it's the opposite. I'm going to try it. Sir, I'm going to try to let it to bend. Sige sir, try to resist it for the other. Bend po sir first. Both are 5 in muscle strength. Now for our last muscle strength, I'm going to flex and dorsiflex the ankles and feet. So sir, ganyan po. Try to resist lang po. Your feet po ganyan po dapat. Then I'm going to put it right there. So sige sir. Other one po. So that 5-5. Now, wait po sir. Relax po muna. Relax. Relax. Sige sir. Try to put your feet down. Down po sir. I'm going to pull it up. Sige sir. Okay po. That's 5. 5-5. The muscle of the ankles and feet. And that's for my muscle strength. Both have coordinated strength, and that is good to hear. Now I'm proceeding to the assessments of bones. So what I'm going to do is to assess the bones by letting the patient in a position. So sir, ano po, dito po kayo. Ano po, ano po, magtindog ka sir, magtindog. Sige sir. The patient is still wait. So sir, ganyan po sir. Ganyan. Sige, tama sa makaya niya. To the upper side po. Sige pa po. Okay, ganyan. Yan na po. Stop. Now I'm going to get my gonometer. Right here. Now, the right side po sir. Left side. Do it again no. From the start po. No. Ano, ganito po. Ganito. Yan. Then do it po. Upward. Until. Oh, ganyan po. Okay. Going to measure it. Oh, that's good. Now, I'm going to do a shoulder joint hyperextension. So, what I did earlier is the lateral rotation of the shoulder joint. Now, do it like that, sir. Do it po like that, the shoulder joint hyperextension. So, wait po. The left side po. Face in that direction. Sige sir, do it. Wait po sir. Going to measure it. Now, let's proceed to flexion and hyperextension of the hip joint. So sir, do it po, supine position po sir. So, umiga ka po ulit. And dito po, bend, this is bend. Now sir, what you're going to do is to try to put it upward sir without it bending po sir, without bending. So, do it po sir for the right feet, without bending. Without bending. Okay, so that's okay. Now, the other side po. Now, okay, that's good. Now, I'm going to do a hyperextension of the hip joint. So, sir, humiga ka po doon. In a prone position po. So, your belly in the bed. Okay, sir, ganito. Wait po, sir. Dito ka. Your feet. Right here. Then po. Now, try to elevate the right feet po, sir. Right po. Okay, straight lang po, sir. Straight. Straight. Wait po, I'm going to measure it. I'm done. Then the left feet. Now done. Okay po. Now after that, I am going to do a flexion of hyperextension, radial and ulnar deviation of the wrist joint. So, sir, ano po, sitting position po, sir. Sit right here po, sir. Sa corner. Okay. So, for the for the hyperextension and flexion, so your hands po, sir. Ganyan. Straight. Ganyan. Then I'm going to measure po, sir. Try to move it upward. No? Yung finger lang po, hands lang po, ganyan. Straight lang po, sir. Upward. Then downward. Then ganyan po. Huwag po i-bend, sir. Straight lang. Then upward. Okay, that's nice. Now, do it like that po. Ganyan. Then put your downward for your ulnar and radial extension. Ganyan. And the other side po, sir. Okay, that's good. And that concludes our joint po, sir. So, do you have any question regarding this ating assessment? Wala? Okay, so that's all. I hope that I properly do the physical assessment right of the abdominal and the musculoskeletal. So thank you for watching.